Okay, everybody, we're in chapter 22, covering microbial diseases of the respiratory system. We're looking at the organisms that are primarily spread through the respiratory route. Inhalation of the microbes starts the process. If you think about your lower respiratory system, deep in the lungs, this is typically free from microorganisms. But the upper respiratory system, your sinuses, your throat, these are colonized by many microorganisms. Your microbiome that is present will usually limit the growth of pathogens. Of course, we know that doesn't always work. We get infections of the respiratory system. Sometimes even organisms that are normally found in the microbiome cause infections, especially if your immune system is suppressed and the ability to respond effectively is lowered. For example, Staphylococcus aureus, which we know can cause a lot of different problems, is present in up to 30% of people right now. If you consider just our class, there's just under a third of our class that's colonized by staph, and we know that staph can cause problems when introduced into different sites. We have to keep that in mind. Our microbiome members may be present without causing disease if they remain where they're supposed to be. If allowed to multiply unchecked or if introduced into a site they do not typically exist, we already know that can lead to an infection. First, we need to talk about streptococcal respiratory infections because they come in a couple of flavors and the streptococci are a very problematic group. The fairly common infection, referred to as strep throat, is caused by what's already a familiar pathogen to you. Streptococcus pyogenes, also known as Group A strep, is a gram-positive coccus. Strep pyogenes causes strep throat, which is more properly designated streptococcal pharyngitis, a medical term. For some individuals, strep throat can progress to scarlet fever, rheumatic fever, or glomerulonephritis. This organism is spread by respiratory droplets. No surprise there, we're in the respiratory disease section of the course. Scarlet fever only happens when the bacteria Strep pyogenes is infected with the lysogenic phage carrying a toxin. You might recall that lysogenic phage sit themselves down in the chromosome of a bacterial host. This particular phage will bring with it a toxin gene. That toxin will lead to scarlet fever. This only happens in the bacterial strains that have undergone the lysogenic conversion. Rheumatic fever is an infection that involves the heart. Heart valves and heart muscle is affected if the individual is suffering from rheumatic fever. Damage to the heart valves and muscle tends to occur weeks after the onset of a strep throat or scarlet fever that was not properly treated with antimicrobials. Fever and joint pain are also common with rheumatic fever. Children between 5 and 15 are more often affected, but adults can also be. Once someone develops rheumatic fever, they are more likely to develop it again if infected with Group A strep. It's believed that the individual's immune response is what's initiating the tissue damage. Strep throat is sometimes confused with viral pharyngitis, but we can confirm this bacteria quickly. We can use those strep sticks, which are the lateral flow or the immunochromatography type tests that are readily available in most medical practices now. We will speak about bacterial pneumonias shortly, and there's another streptococcal pathogen in the group, Streptococcus pneumonia. More on that bacteria in a bit. This next organism is one that is no longer a common pathogen thanks to childhood vaccinations. The infection diphtheria is caused by these organisms that you can see in this picture up here. When you do a gram stain of these types of bacteria called diphtheroids, you see these interesting arrangements that people say remind them of Chinese lettering. This tendency to form these arrangements is also referred to as palisades. The bacteria line up next to each other, like on that image. When you look at an individual that's suffering from diphtheria, they have a very characteristic diagnostic sign, which is this pseudomembrane. In this image, there's this membranous looking film that forms on the throat on the inside of the mouth. It's firmly attached. You can't pull it off. If you try to pull it off, you'll be ripping tissue away. What it is actually dead and dying cells that are forming this layer. This is due to the presence of the diphtheria toxin, which is killing cells. This toxin also is a result of the bacteria being infected with a lysogenic phage. As I was mentioning, a lot of people have these organisms, these diphtheroids in their throat under normal conditions, and they don't cause a problem. They're just a part of your microbiome. If you acquire a strain that has been infected with this lysogenic phage and can produce the toxin, now you get the disease state. It can be a very serious infection if not treated. The DTaP or Tdap vaccines, depending on the version, the D part is the designation that is directing against diphtheria causing organism, Corynebacterium diphtheriae. The vaccine contains a toxoid version of the toxin to stimulate the protection. Vaccination has helped tremendously in the industrialized world, but it's still present in other areas of the world where it's considered endemic and causes death in unvaccinated children. In this next image, we see a more pronounced pseudomembrane in the back of the throat. And again, here we can see that palisading of the bacteria observed in a stain. There are effective antimicrobials, and you can also treat with antitoxin, a short-term use of passive protection of those suffering the effects of infection. While viral infections of the upper respiratory tract are common, they are less common in the lower respiratory tract. Of course, we have spoken previously about the coronaviruses. Some types of coronaviruses are among the over 200 types of viruses that lead to what we refer to as a cold. Of course, they also have specific forms that cause the more serious COVID-19, SARS, and MERS that can lead to overwhelming infections and respiratory failure. The cold viruses typically prefer the nasal cavity to undergo replication, where it is slightly lower than core body temperature. This preference for a slightly lower replication temperature may be why the typical cold viruses may stay in the upper respiratory tract as compared to penetrating deeper into the respiratory tract system. There are over 200 strains of viruses that can cause a typical cold. That's why we can't come up with something like a vaccine against cold. I'm now going to talk about the bacterial diseases of the lower respiratory system. Bacterial pneumonias can cause extreme inflammation of the lungs, and that means that the alveoli, where you have that gas exchange with the blood, gets filled with fluid, and therefore you don't get good gas exchange. That's really the characteristic of pneumonia. You have these fluid-filled alveoli, and the patient basically feels like they're drowning. Physiologically, they are drowning. The patient is not getting enough oxygen with the limited gas exchange. There are quite a few different organisms that can cause a pneumonia. Here are some common ones. For example, the pneumococcal pneumonia, which gets its nickname because of the causative organism Streptococcus pneumoniae, really accounts for a large majority of the bacterial pneumonias. In this little image, you can see the gram-positive coccus. See the dividing set of cells right there? That's actually a common occurrence, and they call them diplococci because you frequently find them in pairs like that on stained slides with the organism. Most people do harbor them in their throat, in the pharynx. The organism does cause pneumonia, especially in elderly patients, immunocompromised patients, or patients that are undergoing some sort of stressful condition. Then it gets into the lungs where it causes a problem. Penicillin is still used for a lot of streptococcal species. Klebsiella pneumoniae also cause this infection. This one is different because it's caused by a gram-negative bacillus. So while the streptococcus obviously is a gram-positive cocci, we have these gram-negative organisms that belong to the enteric family, the Enterobacteriaceae group. The organism can also make a capsule. just like strep pneumonia can, but this organism causes a thick, bloody sputum. The pneumonia with this sign of bloody sputum leads to the investigation of whether you might be dealing with either tuberculosis or Klebsiella pneumoniae. Another interesting organism that causes pneumonia is Mycoplasma. If you remember back from the beginning of this semester, we talked a little bit about Mycoplasma versus Mycobacterium. Mycoplasmas do not have a cell wall. That leads to these very interesting shapes that you can see in this image here. The bacteria get a bit distorted because they have no cell wall. This bacteria leads to what's called walking pneumonia. The symptoms are not typical for other pneumonias, and they tend to be a little more mild. Patients often continue with their activities even though they're feeling pretty down and out. Finally, they get to the point where they need to go in and be seen, and an x-ray reveals the infection. Walking pneumonia has some symptoms that are not typical of other pneumonias, including fever, the feeling of malaise, that just feeling kind of completely worn down, a sore throat, and sweating. Remember, this organism doesn't have a cell wall, so penicillin and other similar antimicrobials would not be a treatment option. You can treat it with other types of drugs, but individuals can be infected and potentially spread this organism. Infected individuals may experience a very mild disease and mild symptoms or no symptoms at all. So this is walking pneumonia. We're going to stop our first lecture of the chapter here and pick up with tuberculosis.